Hello, everybody. Thank you for joining us. And for those that are about to listen to the recorded version, appreciate you reaching out and wanting to learn a little bit more about how to transform healthcare staff experience for better engagement and patient care. We've got with us a couple of experts that I'm very proud and pleased to introduce to you. We go to the agenda, Mark. That would be great. And I had the pleasure a few years ago of working with Mark on a major healthcare system, learned to respect his experience in healthcare as an experience, what I call an experience engineer. And Aimee is a long-established employee advocate in the Ohio marketplace, probably the most active vertical industry that she has worked with has been healthcare providers and healthcare systems. So Aimee is going to cover employee experience trends from the thousands of interviews that she goes to as to why people take jobs, why they leave jobs, that kind of a thing. Very, very insightful. And then Mark is going to talk about better employee-centered workflow with automation and integration, and also how the communications automation is evolving from longstanding traditional voice and phone systems to omni-channel and other methods of communicating internally amongst the staff, but also more importantly, the patient preferences for how a practice will interface with the patient. And then we're going to wrap that up with some conversational intelligence and AI tools. And let me just say, that's going to be talked about with respect to the staff experience. You know, are you going to identify some stressors and some friction in the workflow and things of that nature? Because when you stress the staff, they then are not suited to be working with the patients. And then also, obviously, what pleases the patient and their experience with your practice and or health system. So, and then I'll get back on and recap and provide you some next steps from this conversation so that we can get the conversation started internally within your practice or health system the right way. So with that, Aimee, you take it over.
Great. Thanks so much, Kevin. I'm always happy to talk about what attracts talent in healthcare and what keeps talent in healthcare. And so right now, the biggest concern in healthcare, not just for CEOs, the majority of CEOs, it's their number one concern, is staffing. Staffing and recruiting, retaining staff. But it's not only a concern for CEOs, it's a huge concern for everyone else in the food chain in healthcare. It doesn't matter whether they're clinicians, revenue cycle people who are involved administratively in guiding the patient journey. Everyone feels the heat from staffing issues because with attrition and staffing concerns, people are stretched thin. And it's one of the key drivers for staff burnout right now. They are stretched thin and they're being asked to do more with less. So it takes a human toll for sure on your entire staff, regardless of their role. And, you know, other than the human factor, the morale and the human toll it takes on your team, it's a huge cost. Financially, the cost of attrition, every time you lose someone, when you go to backfill them, presuming that you can actually find a replacement because talent is so tight right now and talent shortage, especially in healthcare, presuming you can find a replacement in order to recruit, onboard, and bring a skilled healthcare worker into your group, the cost is going to be 1 to 1.5 times that person's annual salary. Huge cost. On to the next, Mark, please. So I'm just going to touch on 2 things that I hear on a daily basis, weekly basis that people in healthcare want now. One is on being valued, one trend, and also being well. very often, I'm on the end of a primal scream on a weekly basis from at least 3 people, 4 people in healthcare who say, get me out of my current situation, my current organization, or please help me find a new job. And one of the key drivers there is that people feel like they're not being valued, and it goes well beyond pay. It's really the most frequent thing I hear is some sort of flexibility that's being offered to workers so that they know that you're listening to them and that you value them and you want to work with them. And most of those observations are they want some agency, some flexibility about how and where and when they work. Now, for clinicians, who are involved in face-to-face patient care, they can't always, not come into the clinic or the hospital, but you can address some of their flexibility asks around a flexible schedule sharing, being willing to let them move to another location in your healthcare organization's footprint rather than lose them to a competitor, and recognizing their contribution with some of those soft perks. Another thing that's gaining real traction now instead of PTO is PVO. Have someone tell you who their favorite charity is or volunteer work is, and pay for them to devote some time there. So big trends there is listening to your team and giving them non-traditional benefits that go a long way to feeling valued. The other trend is in wellness. Super huge right now. It's the balance and well-being that people are craving right now in healthcare. There's a marketplace initiative underfoot, and that is with Glassdoor and Indeed. And anyone joining your organization typically goes out to Indeed and Glassdoor and checks out if you're an employer of choice. A lot of folks in healthcare, they won't join an organization unless they have a 3.5 rating. Well, now there's a new set of ratings, and they're wellness ratings. It's basically how well do you care for the well-being of your people. So, and it's not just the squishy happiness and satisfaction. The two that are hitting high marks in healthcare are stress and purpose. Again, when I get those primal screams from folks in healthcare saying, get me out of my current situation, one of the most common things I hear is, I've lost the meaning and the purpose in what I do. I no longer have the reason on a day-to-day basis. The reason I got into the profession is not, I don't see it anymore. And a lot of clinicians are saying the face-to-face time I have with patients has completely diminished, and I don't have that connection anymore. If it's anyone else, it's they're being asked to do low value things that they would like to leverage elsewhere. So it's essentially losing that sense of purpose and meaning. And a lot of folks are saying, I don't want to put up with that anymore. So with that, Mark, I'll turn it over to you.
Thanks very much, Aimee. So what I'd like to begin with is to share with you some of the information that I look at that guides my thinking when I embrace a lot of the topics that you've started out with here. And I'll start with a piece that just came out recently from the American Association of Critical Care Nurses. And what this looks at is the job satisfaction elements that you talked about a moment ago that people are going to be looking for when they go out to a place like Indeed or Glassdoor. So the kinds of verbatims you'll typically find out there that people write are going to be a lot of these topics here. So am I valued? How am I valued? What kinds of workloads are they placing on me and things like that? And one of the things that I like about this is that when you look at all of these different elements here, not only have they quantified them based on the results they got back from their survey, but you know what? I bet you'll find that these are the very same things that are impacting not just the frontline nurses, but all the support staff that work alongside them. They don't have the nest egg on these kinds of issues. When you go into an organization and you find, for example, that, does the organization value my health and my safety? It's everybody. So part of what I like about this is it says, you know, instead of focusing on just the nurses, for example, let's talk about the culture, the environment, because it's going to impact everybody. And yeah, the nurses are going to be the front part of it because it's an expensive piece for you to deal with, but it's everywhere. So if you're going to fix it, take a look at all the other things that are going on out there. Here's another one that just came out recently from McKinsey, where they're talking about not only you know what's happening with these frontline nurses and so on, but the fact that they're going to be leaving, and it applied some kind of a number to it. So roughly, you know, a third are now saying, and this is probably consistent with what you hear when you're getting those phone calls on a daily, weekly basis from people saying, "Help me get out of here." It's probably, you know, about this. Now we're seeing this begin to plateau and flatten out a little bit. However, one of the things that you find is that these problems that we're talking about are expected to be the biggest problems all the way through the end of the decade. Right. So it's not going to be finding new sources of revenue and things like that. It's this. So if you're going to, you know, find something that you want to go focus on, here you go. Start here, right? Okay, so here's another one, Press Ganey. Everybody in healthcare knows who Press Ganey is. And they took a look at this as well, and they're trying to figure out, okay, what's behind all this? And a big piece of what they found too is, and you touched on this, engagement. Well, when we talk about engagement, what do we really mean? That blue box off to the right explains it in their definition. How do I feel emotionally? What's my personal connection to the organization? In other words, if I had to summarize that, to me, what this says is, what difference does it make if I show up today? What's my contribution to the overall organization? Does anybody actually know this? Will it matter? Do I feel like me being here makes a difference? Okay. So with that in mind, I'm now going to come back to what you said a minute ago. When we talk about turnover, here's another one that came out from Nursing Solutions, where this was also a brand new study that just came out, where they quantified this. Now, they're looking at what are the reasons, and it's similar to all the other things we've talked about here, and you touched on this as well, some of the scheduling flexibility, for example, things like that. Again, this ties back to that first slide that I showed you, though, which is, oh, guess what? The same thing applies to all other employees in the organization. It's not just frontline nurses. Now, I'm going to ask you, Aimee, this number that they gave here, the cost per turnover, I'm imagining that what they did is they leveled that out against all resources, not just frontline nurses. But how does that number look to you in terms of the cost to replace people when you do have turnover?
It looks low because there's a huge amount of time and effort that goes in on the sourcing and recruiting side, and bringing, you know, onboarding someone and bringing them up to productivity. So when I say 1 to 1.5 times someone's annual salary, that includes all the effort that goes into bringing them into your organization, then bringing them up to productivity, all the costs, your overhead costs in an organization that are required to do that, for sure.
Yeah, and I would agree with you on that. And in fact, I'll take it one step further and say, when we talk about bringing them up to productivity, I don't know what your experience has been, but even if you're really an experienced person in that space, it'll take you 3 months just to figure out where the washroom is, you know? So it's probably, in my view, it's going to be a good 6 months before you get them to the point where they're really doing a pretty good job based on just learning the organization, learning who to reach out to when they have a need, you know, who really can help me guide policy and things like that. So it's not something that's going to happen just by calling HR and saying, send over more people. It's not that simple. There is a lag time in what's going on. So with that in mind, let's just kind of take a quick review then. So one of the things we find in all these studies is that people are exhausted. They've been through a lot over the last few years, but part of what happened in the last few years is not just that their workload went up, but they were exposed to a lot of challenging behavior on the part of the people they're dealing with. I think that's the most politically correct way I can say that. But they've been on the receiving end of this, and they're just beat up. They're tired of being yelled at, screamed at, and and held accountable for things that they had no part in. They don't get to decide a lot of the things that they're on the front line trying to explain away. And therefore, what they do is they go back to that concept of, great, do I make a difference? And if I don't feel that I make a difference, I'm not going to be engaged in the overall process. Because of that, what have we seen? A lot of people plan to leave. That's why they're reaching out to people like you. Help me find something more meaningful so that I can spend more of my career years doing something that I think I can make an impact on. We know that it's expensive to replace those skilled staff when they do leave. And frankly, even if you said, well, I've got a lot of unskilled people here, guess what? You may think they're unskilled, but they're skilled. It's just a different kind of skill, and you're just not giving it the right kind of attention. And then finally, what's the solution? Now that we've identified all these things, what are we going to do about it? Well, let's start with, that American Association of Critical Care Nurses talked about the concepts that they're looking for. So when they talk about a healthy work environment, and this probably aligns back to some of the things you've seen as well. Do we have these skilled communications between the people that are in this environment? Do we have what we really believe to be true collaboration? Do we really treat people as if they have something valuable to say add to the conversation? Do they believe in the decision-making process? It's not just that it's effective, but do they believe in it, right? Because they're the ones that are going to have to explain it and support it. Do you have enough staff? Am I doing the work of 2 people and getting the pay for 1? Because that's not going to last very long. This, to me, though, the next one is meaningful recognition. And I'm not talking about, let's have cake once a month and call out whose birthday it is and that kind of stuff. I'm talking about when people are doing things that really make a difference in the moment. Do you recognize it? Do you call them out and say, you know what? I want you to know I saw that. And it matters. It makes a difference. That's what people want to know, is that you knew I did something and it mattered. And that's what really leads to authentic leadership, that you're not just in this for you, but you're in it for me too. So when we talk about engagement and attrition, McKinsey came out with some things that they felt were important in this as well. So they grouped this into 2 areas. The first is around workforce opportunities. So here we're talking about, what do we do around retention? What are those environmental factors that we've talked about a little bit here? So do I have purpose? Do I have, the feeling that I'm valued by the organization? Is there flexibility, that scheduling piece that you talked about? What are my professional development opportunities? Now, I think it's important to also look at this and say, there's some people that are not looking for, they are in the profession they want to be in, but how do you identify that and say, what works for you? Different strokes for different folks. So how do we know what works for you? What are the total rewards? Now, I'm going to come back to something you talked about earlier too. Mental health is a big part of that. So if I'm now coming to you and recognizing that I think mental health could be an issue, am I offering something for you in that area? I don't want to just call it out. Do something with that, right? Continuing education. So do we also say, look, if you really do have professional development opportunities, I don't want to just make you the senior something or another. I want to give you the training to be really good at being the next team leader, supervisor, manager, whatever, because being a good, for example, nurse doesn't mean that you're a good nurse manager. There are different skill sets, and you've got to have training in order to do that well. And then when we talk about those leaders, what are we doing to the leaders to send them out for their training on a regular basis to make sure that they're doing a good job as leaders to lead this workforce? The second area is going to be under the workload opportunities. So here, what can we use technology for example, to understand the work that we are presenting to people and how we're doing it and when we're doing it and the impact of the work that we're providing for them. Based on that, how do we kind of close the loop on that, come back and say, well, what we're learning is that, for example, when we look at job roles and the process, we're giving you the wrong work. This is what you were talking about earlier. We go back to those frontline people, and you know what they're saying? I didn't go to nursing school for all those years to learn how to answer the phone. That's not what I'm here for. You know what I'm here for? Is to make medical decisions, okay? Let me get in front of patients, but don't give me busy work that has nothing to do with anything. And that is how you grow your talent pipeline, because that's how you're really getting focused on what that hiring process looks like. Who are the partners that I need in order to make that work? And now we have a really meaningful environment. And this will tie back to what you said in your first opening quadrant. How are you valued? How you're supported? How are you heard? Now, there's going to come a time when the CFO is going to come to the party and say, well, that all sounds great. And this is a thing that Kevin is a big proponent of too. Show me the money. Where's the business case for all this? So here's another study that just came out from Harvard Business Review. Oh, and I should mention that all of these things that I reference in here are, there are hot links into all this. The viewers to the webinar will get a copy of this presentation. And when they go into there, they can click on all these links and it will take them to all of the sources that I'm referencing. So here's a recent Harvard Business Review piece that talks about how does all the stuff we're talking about today impact your bottom line? And what they found is that, you know what? There is a link between how you treat people, how they feel, how they work, and the bottom line. And there is provable ROI in improving that employee experience. So this is not just some pipe dream. It's not just, oh, let's sit around and sing kumbaya. There's a real business case behind that if you want to get out a piece of paper and a pencil and actually do this. Now, along those lines, one of the things we found, and I'm going to touch here on that piece that you mentioned earlier around stress. So that's a lot of it, is what kind of stress are we talking about? We've partnered with Thrive to do what they call resets. So essentially what this does is it is listening to encounters that are happening between caregivers. It could be people in your appointment call center. It could be anybody on your staff that's interacting with your members, patients, customers, whatever. And it's trying to pick up on stress levels in those conversations. And when it picks up on those stress levels and figures that you're getting to a certain point, what it does is instead of serving up another task or work item or phone call to you, it serves up a reset. And a reset could be 60 seconds of something that you've already determined in advance that really works well for you. So these are customized to you as a human being, what works for you. No two people respond to the same stimulus. So it could be that you like just listening to the sound of the waves at the ocean, or maybe it's puppies or whatever it is, and it'll be visual as well as auditory. But what it does for 60 seconds is it gives you this reset to say, okay, let's take some deep breaths here. Let's calm down before we go on to the next thing. Now, your CFO, back to that person, is going to say, well, hang on a minute. When I'm looking at productivity and occupancy rates and so on, you're telling me that I've got calls backed up in queue. And what you're going to do is instead of serving up a call, you're going to serve up a reset. That's exactly what I'm saying. Because one of the things that Thrive has found is that if we don't do that and we let you get wound up and even more wound up and more wound up, and then you go on to the next encounter with the patient, the handle time on those subsequent encounters also goes up. And then they get escalated, and then you get the patient wound up. And now we've got everybody going off in the wrong direction. So what we find is that if we take that moment to just say, look, we know that that last encounter you had was particularly stressful. Let's take a pause. It turns out that when they do the math on that, your productivity net goes up. And in fact, they will find that in the course of the day, you might be able to take somewhere between 6 and 10 more encounters because you calm down. So it's a little bit counterintuitive, but it's not when you think it through. So I think it's just an interesting way to look at how we're managing stress, because now what we're really saying is that that other bullet point that you had on your quadrant there, how do we help you be well? Right?
Of course.
Okay, so now let's talk about this employee-centered workflow. What kinds of process, technology, tools, and so on are we using? Why do we care? Well, our good friend Simon Sinek has this wonderful quote out here that we've all seen, and we believe this. I think that if we've got happy employees, we think that translates into happy customers, members, patients, however you want to call them in your world. And ultimately, that has this impact on the bottom line. So again, we're back to that CFO, because that's going to be the deciding factor. Is there financial angle in there? And we think that there is. So we just have to take a little bit of time and try to find that. More research. How do you, if we believe that that is an issue, and how do we keep our own internal people happy and worry about staff support, so on? How do we do that? Well, okay, another Harvard Business Review article that just came out here a month or so ago. Top performing organizations, top performing, the ones that are the real gold standard, the market leaders in our space out there, they are focused on how do we fix broken process? Because when you think about a lot of that stress, a lot of that busy work, a lot of the wasted effort that we put on people, you know what it is? It's Band-Aids. It's workarounds. It's finding explanations for things I didn't have a part of, telling you what our policy is, telling you what our rules are, and telling you, I know it doesn't make sense. That's all the stuff we ought to be focused on. So what are those broken processes and how do we fix it? How do we leverage technology to find out where the bottlenecks are and therefore get really focused on the stuff that's stupid, that's wasting time? And net, how do we work smarter, not harder? So when we think about the factors that make for that great employee experience, here's another piece of research that just came out. There's a lot of variables in there, so there's got to be mutual trust. But that's obviously something that's part of your own culture. You're going to have to work on that and figure out what does trust mean inside of our organization. A big piece of this too is going to be C-suite accountability. So you have people at the top of the house that put their hand up and say, I own this. This is not on you. This is on me. It's my job to fix this, and I'm going to give you the support necessary to make that happen. Is there genuine, true alignment between what we see with the employee values and the company vision? Because if there's not, got a big problem here. We're back to recognizing success at an individual level. How do we say, Aimee, it was you, personally you, that made the difference here in making this happen? And then ultimately, how can we use that technology to find and reduce that friction that we put people through on a daily basis? Now, historically, what we've seen here is that if you prioritize that, we're back to the CFO. Guess what? There is a business case that says if we do that, we can see measurable growth in revenue in your organization. The problem is that if we've looked at this in a historical lens, we've also said that, well, the way that we do that is we just hire more people. So if we've got more work, hire more people, even though it's Band-Aids and it's a stupid process and all that, we just throw people at it. And the problem you have now is there are no people. And Aimee, you probably see this on a regular basis where you've got organizations that come to you and say, I'm looking for whatever, fill in the blank. I know that I'm working with companies right now. One in particular has had over 200 requisitions approved out there for over 2 years now. There are no applicants. There's nobody applying for this job, and it has nothing to do with the pay. It's that people have just said, I don't want to do this. It's just, I'm done.
Right.
So when we look at a more modern solution is back to how do we work smarter? So I like this idea of developing tools and processes where we have listening built in. So where are we finding these friction points, things that are really driving people crazy, wasting time, not allowing them to work at the top of their license or what it was that they were trained or hired or paid, or in their mind, what they're trained or hired or paid to do? And how do we leverage that for continual process improvement? So think about even something really simple, like you have a patient that goes out to your public facing website and puts in a search term that says, I want to find out about flu shots, and the search results come back nothing. Okay, well, who's capturing all of that kind of stuff to be able to say, people are asking that question, how do we figure out the answer to it? Because if they can't find it there, they're now going to want to talk to somebody and get their question answered. So how do we improve the process? And people will give you these hints all day long. Tell me, this is the information I'm looking for. Tell me where I can find that. The next thing we have to do is find out what the root cause is of this employee experience, this friction, these issues that people are facing. Is it because we've got dumb process? Do we have dumb rules? Do we have things we're wasting time on? We're asking patients to continually repeat their electronic health record number or their date of birth or whatever. And it has nothing to do with anything. They just want to know how late can I schedule an appointment today, right? And then finally, what's the possibility that we could move work to people instead of moving people to work? And I'm going to explain that a little bit here in just a moment. One of the things that we've done at Genesys is we've recently honed in on this thing, and we now are really focused on this thing called an experience index, where we're going through and quantifying the experience that the employee is having. So we've spent years talking about, well, what are members, patients, customers doing out there and looking at their journey? But if we're back to this central theme that it really starts with the journey your employees are on, what are we doing to map that? And that's where we're focused now, is to look at those things and to figure out, what does it really mean to the people inside your organization? And this starts everything from, what are you doing on the recruiting front to hiring? How do you onboard people? How do you set them up in their environment? Because if I don't get you off on the right foot, it's not going to get better over time. It's actually going to get worse. So what are we doing to try to help you succeed and be a valuable member of the organization? Now, once we've done that, we have to say, okay, well, you keep talking about these journeys that employees are on and all that. Where are we looking to find that? Well, guess what? We can figure out, for example, that we want to know what's happening. We have all kinds of analytics and metrics behind that. So the front end of it, every time somebody on your staff is having an encounter with a member or a patient, we've got all these tools like recording and screen capture. So you're capturing the screen. Does anybody look at that? What's actually happening on that screen? I can see, for example, that employee of yours had to go to 5 different places in order to find the answer to this question. So it's great that you looked at that and you ticked the box from a quality monitoring standpoint to say, yes, they went to the right places. The question should be, why are they going there? So what are you doing with this to actually look at it? You have speech and text analytics. Great that you have that. You're able to say, yes, we have that in place. Who's listening to this? Who's actually listening to the text, the speech, and looking at the text analytics to say, can you see, can you hear, can you feel the tension, the friction that's happening there between your staff and the patient or the member? Where's that sentiment? And I want sentiment not just from the patient. I want to hear about sentiment from your staff, because if you can feel the frustration in their voice of having to say something that they know is stupid, then there's an opportunity for you. And how do you go through and look at this and tag those things that you know need to have some attention? The next thing you want to ask is, why is this happening? So this is where we get into the quality and compliance and so on. So here we're going to look at those activities, those interactions. How does that impact performance? If I'm wasting time on a lot of things, that's the thing that's keeping me from going on to the next thing that I ought to be working on. So how do we look at all that and then figure out, of all of this, what stuff do we want to export into our data lake? Because that's where we're going to now find the opportunities that we need to synthesize for future opportunities. And then we now have to ask, well, great, how do we improve this? So here we're going to look at, this is going to come back to a lot of those components around the employee performance and their scheduling and so on. If we get smarter about the work that we're doing, it has an impact there on what we're forecasting and what we're scheduling, because the work itself changed. It got better, it got smarter. We now have to look at a different set of standards for how we're monitoring things intraday. And what we mean by adherence. Adherence to what? Adherence to a smarter process. How does that impact scorecards? On scorecards, instead of just looking at how many encounters people have, how about if we start including on a scorecard how many good ideas you submitted that got imported into our process change? What a concept. We're actually listening to the frontline people who can do something about this, right? And that is going to influence this concept of employee self-management. If I feel like I'm engaged, I'm an important part of the organization, that you're listening to me, how are you measuring my ability to manage myself? And then how does that impact coaching, learning, and so on? And one of the things that interests me about coaching too is we always think of coaching as one way. I'm going to lean over your shoulder and tell you something. How about if I lean over your shoulder? How about if I'm coaching you? How about if I'm training you? How about if I'm impacting the learning module for the other person that's coming along behind me? Now I feel like I'm really engaged and I'm an active member of the organization. And then ultimately we get to gamification. So one of the things that I'm concerned about here is that this is a tool that has been used largely from a productivity standpoint, and I would argue that that's a misuse of the tool. So we're not trying to figure out how many more widgets a day can you make with your widget making machine. What we're really focused on here is, are we creating an environment for you that's interesting? And that to me is where gamification can really play an interesting role, is, are you identifying problem areas? Are you trialing solutions on that in your work environment so that you can come back and say, we tried this, and solution A had a better result than solution B. That's what gamification can really do for your organization. And you're going to say, well, okay, well, where does this happen? Well, here's a typical, provider environment where you've got people making appointments, and then there's an encounter, and they're doing things and so on. And okay, great. We know that journey for the patient. Guess what? Every single place on the map is an opportunity to do all the things that I've just mentioned. There's nothing here that escapes this. Every single one of these things is a place to try to find some lift. The next thing that will always come up in these conversations is, well, great, we're hearing so much these days about AI. Can't we just let AI solve that problem? The problem, by using AI as your crutch, is that nobody knows what it means. It suffers from this concept of vagueness, and it really doesn't tell us anything, except I think if we're honest about it, what it really means in practical terms is how you're running the operation, and how can you run your operation more effectively. That's what it means. So the next question I generally get is, okay, well, that's terrific, but how do I know what goes where? And the best way I can think of to describe this is if you think about all the work that we do throughout the course of a day, and you were to pile it up on the table in front of you as tasks of some kind that need to be done. And those tasks could be confirming appointments or billing questions, whatever it is that you have to go through and do. The question that you have to think about is, what are those things in front of you that are uniquely human that only a human being can do? And then what's everything else? Because the what's everything else pile is probably the place where AI is going to be able to help you. So for example, if we look at AI, if it is a question answer, there's only one answer to the question. How late are we open? Do we have an appointment available on Tuesday at 3 o'clock? Those are questions that only have a single answer, yes or no. And in that particular case, AI is perfect at doing that. And in fact, that's the kind of stuff that makes people crazy from doing, because you're asking me to do something that I know could be offloaded to automation. However, if it's something where there are a lot of potential answers and there aren't any precise rules, and what you really want is an opinion, or you want me to help you evaluate something, that's where I want humans involved. So for example, in a healthcare world, we could say, we know that when we subject imaging to AI, it can find spots on scans better, more accurately, more predictably than a human can that's going through and looking at, lung cancer images and things like that. Do I want Siri telling me that I have lung cancer? Probably not. I want a human doing that, because I now want somebody to walk me through what my prognosis is, what my options are, and so on. So that's a good example of where you can use AI to get the work evaluated, gathered, collected, ready to go, serve it up to somebody who then can do the human part that they need. Earlier, I mentioned this concept about employee-centered workflow. And, historically, we've talked about, well, what we do is analyze demand. It's a customer-focused piece. What is it that people want? What time of day do calls come in? How many of them are there? And so on. And from that, we create the forecast. And then what we do is go out and hire people based on what we think the anticipated workload is going to be. Instead, what I'm really focused on now is, how do we move work to people? So how do we identify when the staff are likely to be available? And then from that, calculate the available staff, the work that those available staff can actually handle. And then let's move people to the time when our customers, for example, to the time when we have staff available to do that work. So what we've found here is that, if you take that first approach, moving people to work, what we've said to our customers, our members, our patients is, we're open for taking appointments from 8 o'clock in the morning until 4 in the afternoon. So guess what? Call volume spikes at 8:01. No surprises there. But if instead we think about, well, when is it that patients wanted to make appointments? It was Saturday afternoon at 3 o'clock. Guess what? It turns out we have people that are willing to work Saturday afternoon at 3 o'clock. So let's find out when the staff are available, and then let's use that friction to nudge people in the right direction, because what we'll find is then we have people that are willing to work, and lo and behold, it turns out it's at the same time of the day that the issues were actually coming up in the first place. Okay, so the third area that we wanted to touch on was this concept of workflow integration and how it ties back to the communications hub. So the first thing I like to point out is that our brains are set up in such a way that we like straight lines. We like things that are very linear. We like to use even these customer journey maps that we've just been sharing here to chunk things out to say everything fits into a nice, neat little space and a nice, neat little box. But the truth is that life is messy and things don't really fit into nice little boxes and follow straight lines. That's just how things go. So it's, you know, this notion that it's nonlinear. Okay, well, if we know that, how are we going to solve that? Because guess what? On top of the nonlinear life thing, we have communication issues. Some kinds of things that we deal with are well suited to synchronous communication. We're back to the, do I have a question? Yes, no. Can I get an appointment at 2 o'clock? Is it available? Do I need to know that in real time? And it's just between me and the person making the appointment. Terrific. That's a synchronous communication. But in a lot of cases, it's not synchronous, it's asynchronous. So I might call the Ask a Nurse hotline. I was out working in the yard. I got stung by a bee. Terrific. Put ice on it. If the swelling doesn't go down within an hour, come back to me and let's get you into urgent care. Well, I don't want to talk to another nurse and restart my story all over again. The first one told me to, I don't want to do that. I want to talk to the same person and pick up where we left off. Therefore, I want it to be an asynchronous communication environment. And if this gets escalated to somebody over in urgent care, I don't want to start all over again. So there could be more participants that get added to that communication over a period of time. Let's do that and make it seem like it was seamless. Now, when we do this, we know that every single time that some of these things happen, there are going to be different systems involved. Sometimes there will be a system of record. In healthcare, it's that electronic health record. We know there could be a system of action. That could be things like, I need to send out an appointment reminder, because that we find that if we remind you when your appointment is, the likelihood that you'll show up is greater. We also need a system of engagement. And the thing that's important to note here is that sometimes you need a system of record, sometimes you need a system of action. You always need a system of engagement in order to communicate between any two people. What does that look like? Well, I've drawn this picture here of what I like to think of as an interaction hub. So you've got inbound and outbound. You've got arrows in, both directions, from people inside your organization, outside your organization. They're all trying to communicate with one another. They're using voice, digital, fax. Guess what? In healthcare, I just saw this statistic earlier this week that one of the clients that I'm working with now, 40% of all of their workload comes by fax. So in healthcare in particular, fax is alive and well. And so when we look at this, what we're really trying to figure out is, who are these people on the outside? What do they want? How do we know you? How do we know you in relation to this particular event? What information do I need to serve up to somebody on the inside of my organization so that this gets handled effectively, efficiently, and we're not wasting time asking you questions that we should already know the answer to? And so when we look at this, we know that every time that we have an encounter with somebody, we start by this intent phase. We're trying to figure out who you are and what your intent is right now. What we have found is that we can use some level of automation up front to do a lot of that piece. Great example of where we offload that work. We can contain 98% of that up front just by asking you, what's the purpose of this encounter? And you can do that whether it's voice, digital, it doesn't make any difference. And then we find that if we offload some of that work, like appointment confirmations or appointment changes, things like that, bill pay, that kind of thing, we can contain up to a quarter of that workload in automation right up front and not waste human time on stuff that's really low-level, mundane tasks. We then have to find somebody to do this. So what's the right resource? Are they available? Are they likely to be available for the duration of what we think the handle time will be for this encounter? And then once we do that, are we meeting you in the channel where the member or the patient wanted to be met? What's their preferred method of communication? Because what we don't want to do is have you stand up, for example, a nice patient portal someplace. The patient goes to the portal to make their appointment. They try to make the appointment and it fails. And now what we have to do is go to another channel and make a phone call. So keep people where they want to be, because that's what they're really trying to tell you. And then when they get there, in that right channel, can we automate some of those low-level tasks? If we are now handing this off to somebody, a live agent, are we delivering information about this so that we're not asking questions and asking people to repeat themselves? Give them knowledge nudges so that they know, based on where this conversation is going, what they ought to be doing, and then managing stress real time in the way that we talked about earlier, to say, look, if this is going sideways somehow, how do we take some moments out to be able to fix this? And then finally, how do we improve this? How do we close the loop on that and feed that back into our process improvement so that we can reduce future calls of the same type, and then do a lot of those other things that are really meaningful in healthcare, like manage those gaps in care, look at the chronic disease management, and so on. That's what I had for you. If you want more information, I've got a book out here that you can go out and get that will also give you some ideas on how to go through and fix this kind of stuff in your service process. And that's what I wanted to share with you today. So, Kevin, I'll turn it back to you.
Thank you, Mark. First, I want to let everybody know that these are two industry experts with lots of experience on the front lines and developing strategy for experiences for both the patients and the staff, which we've learned today. If anybody wants to follow up with us, and you'll see that at the end here, I'll actually buy you a book, one of Mark's books, so you can read how smart he is in print, and I'll do that. So a couple key things from my years of experience being involved in being an architect of a sales and marketing information system that later became customer relationship management systems. That's a single point of truth. A real key to this is more and more you need to be in the front line. They talked about band-aids being put on things, challenges in the workflow. You need to be out on the front lines and getting the user's input into what you should be sourcing to make their jobs easier. I find many times that the technology people hear about a problem, they're in a C-level meeting, and they think they have direction to go, they understand it, and they go do it. They're not on the front line. Go seek out the frontline workers and get their acceptance first. Second is, I find that there is always a competing set of priorities within an organization. You should be integrating to every application that's in the workflow that serves the patients and de-stresses the staff. Okay, you need to have application development people driving the change. And a lot of what Mark and Aimee talked about here, it's more of software people, less of telecommunications and phone system people. Okay, and then the communications automation platform isn't telecommunications automation platform. It's communications automation platform, and that is your traditional voice. Mark Brent mentioned fax, which I have a lot of experience in back in the day. But now you're going to be getting into chat, SMS, all kinds of different methods of interacting to the patients, and you have to meet them where they want to be, and it's not going to be the phone system in the future. And then when you do all that and you unify all that, you get all the applications integrated, you get the users involved and they're using things the right way, and you get everything automated from all of the different channels, you're going to have indisputable data. One of the biggest pushbacks on the conversational intelligence and AI is that it's not accurate, right? And a lot of times it's not accurate because they're only getting the voice streams, or they're only getting email streams, or they're only, whatever. And you need to have all of these things done so you can get accurate data. The key point in this is you heard Aimee and Mark talk about the cost of attrition in an organization. And if we think about what causes that attrition, and it's stress in the workflow, inability to serve the patients properly, that attrition cost is a bottom line cost. And I do not see a lot of organizations capturing that in their economic evaluation models to make investments in software or communications platforms. I would also say to you is that if you are not easy to do business with from a patient perspective, I just had my knee replaced last year. Okay. And I can tell you the whole experience with the firm that I had it done with is behind the times. Okay. And so the tech people are reactive to lots of demands, different physicians having different preferences, all of those things. But the lost patient is a revenue lost item. And so that's a total economic impact. In the past, when we did phone systems, it was purely hard cost savings. I can tell you with these opportunities, it's total economic impact, not ROI. I hear people throw out ROI all the time. And this is a red flag to me that they're not really looking at it the right way and they don't have the right people in the conversation. So that's a key thing. We are here to help you start that conversation before you take that step. That's going to be really important how you take that step. So you want to learn more. We're going to have more of these webinars. KANO is going to host more of these webinars weekly on Wednesdays at noon Eastern time. And we really encourage you to follow us and learn more about what these opportunities are. And it's all about starting that conversation. People out there that have customers that may be in a business similar to KANO Associates or Genesys, if you have customers and you really want to pull in Aimee's expertise on the front end of that, around that economic impact of the employee experience, I encourage you to do that. And now you can see on the screen, let's connect. And that's going to be an opportunity to connect with Aimee, KANO Associates, employee advocate, healthcare expert. Reach out to Aimee and we can engage Mark and any other, tool that you guys are looking to approach. But this is for the frontline employees. They're high attrition costs. They're looking for a better workflow. And this is all about helping them. Even if you're in leadership, you need to be a servant leader. So this is going to help you become knowledgeable on how you're going to make your team happier. So with that, I think I have a few questions here. So who typically leads the way in an organization that really has the attrition problem and is trying to improve that employee experience? Who within a healthcare practice would be the people typically involved in that conversation?
From my perspective, it's typically the director of HR, the CHRO. It can be anyone in operations, either patient facing. So in operations, it could be revenue cycle, because we all know that the revenue cycle starts with that first patient interaction, and that can be front desk scheduling. That's where your money, getting the right data there affects collecting the right reimbursement on the back end, your revenue cycle all the way through. And any C-suite, I think it can actually come from anywhere.
Yeah, I would agree with that. I think that there's both a tactical and a strategic answer to that question. The tactical is obviously going to be the frontline HR management, that type of folks that are focused on how they're backfilling those positions and so on. But strategically, it's going to go back to that total economic impact story, Kevin, that you were referring to a moment ago. And now I want to be talking to the CFO. They've got piles of money sitting on the table all day long, and all they're doing is moving those piles around, and you're competing for that money. And once you can get in front of those folks and say to them, does it even make sense to you? And I think what you're going to find, and Kevin, you probably see this too when you have those conversations, is those folks will say to you, not very often somebody comes in here and asks that question of me in that way before. And now that you pointed out, you're right. That's something I should have been thinking about.
Great. I have one other question. Obviously, somebody is not in healthcare. Does this apply to other industries like retail or insurance? This kind of a employee attrition issue with the opportunity to do these things that we're recommending in healthcare. Aimee, I'll let you go first.
Absolutely. I think, Mark's observation about changing the post-COVID, I think one of the great things that COVID did was to show us that remote work, hybrid work, changing the way in which people work or engaged, that's changed forever, and that affects all industries. So I think there's every opportunity, and of course I work in other industries other than healthcare as well. So I think there's every opportunity to for other industries as well, fintech, insurance, retail, you name it. Mark?
But one of the guiding answers for me in addressing your question, Kevin, would be look to what's happening with commercial real estate. So companies can put out all the orders that they want that you've got to come back to the office. Guess what? Right now is probably not the time to be investing in commercial real estate because people are not coming back to work. They're going to do work, but they're going to do it from where they believe makes sense for the work to be done, which is not necessarily where you think. It's going to be where they think. So guess what? Whether you invited them to participate in the conversation or not, they're going to give you the answer with their feet. They're walking to where they think the work needs to be done. So if they're going to work remotely anyway, then I think it causes you to stand back and think, okay, well, I'm going to have to reimagine what work really means. When we talk about this whole concept that's been throughout our presentation today about engagement, how do I engage people if they're not physically in a building where I can see them all the time? I think what we're finding is that a lot of the stuff is going to be a hybrid where there is something that to be said for now and then we do need to have people together because there's something magical that happens when we're in the same room at the same time. And there's talk at the water cooler that I can't do through Slack, for example. It just happens in real time. But I think all the other industries are going through the same thing with employee turnover, caused by stress, engagement. All these variables are the same, doesn't make any difference on the industry. And I would bring it back, Kevin, to your final point, which is total economic impact. If you look at that through that lens for all the other industries, I think you're going to find the exact same situation.
Right. I appreciate those answers. And to use the real estate term, I think that we usually say buyers and sellers markets. And I think in business, it's the employee or company's market. I think it's clearly an employee's market because like you guys said, if company does a mandate and have valuable employees that don't want to come to the office all the time, I think they can, if they're good employees, they'll find a job elsewhere. So I think people need to not be so authoritarian anymore. It's part of we're all a part of a team, in an organization. So, well, I want to thank you two for joining us today and for the people that joined the webinar, both joining it now live and those asking questions and those that will be watching the recording. We are still sharing the screen with Aimee's barcode to reach out to her. And if you want to take the next steps in your organization, reach out to Aimee and she'll help guide you those first steps. Thank you, everyone.